Another day, another video of first aid by Constipation fever. Causes, symptoms and treatment. First aid by Constipation fever is not a medically recognized condition. However, constipation and fever can occur together due to underlying medical conditions. Here is some information on the causes, symptoms, and treatment of constipation and fever. Causes of constipation. Dehydration. Dehydration, constipation, and fever are all common medical issues that can be caused by a variety of factors. Dehydration occurs when the body does not have enough fluids and can be caused by not drinking enough water, excessive sweating or vomiting, or even certain medical conditions. Constipation occurs when stool moves too slowly through the digestive tract, which can cause discomfort and other side effects. Fever is a common symptom of infection and can be caused by bacteria, viruses, or other illnesses. It is important to stay hydrated and to get medical attention if any of these symptoms become severe. Lack of fiber in the diet. Eating a diet low in fiber can lead to a variety of health issues, including constipation and fever. Constipation is a condition in which you have difficulty passing stools or pass hard, dry stools. It is a common symptom of a diet low in fiber, as the body is unable to break down and absorb the food fully. Fever is a common symptom of an underlying health condition, and a lack of fiber in the diet can often be a contributing factor. Fiber helps the body to properly absorb and break down food, and when this is not happening, it can lead to a buildup of toxins and other substances in the body which can cause fever. Lack of physical activity. Physical inactivity is a major contributor to many health issues, including constipation and fever. When the body is not regularly engaged in physical activity, it can become sluggish and lead to constipation. Constipation can cause a person to become uncomfortable and can lead to serious health complications. Fever is also a result of physical inactivity, as the body is unable to regulate its temperature when it is not regularly active. This can lead to a range of symptoms, including chills, joint pain, and fatigue. To prevent both constipation and fever, it is important to maintain an active lifestyle and ensure that you are regularly engaging in physical activity. Certain medications. Certain medications can cause constipation and fever as side effects. These symptoms can range from mild to severe depending on the type and dosage of the medication. It is important to speak to your doctor about your symptoms, as they can indicate an underlying medical condition or an adverse reaction to the medication. Your doctor may adjust the dosage of the medication, or switch you to a different medication if necessary. Additionally, lifestyle changes such as increasing your fiber and water intake, exercising regularly, and avoiding processed foods can help reduce constipation and fever caused by certain medications. Certain medical conditions such as irritable bowel syndrome, thyroid disorders, and colon cancer. Certain medical conditions such as irritable bowel syndrome, thyroid disorders, and colon cancer can cause constipation, fever, and other digestive issues. Irritable bowel syndrome is a chronic disorder that affects the large intestine and can cause abdominal pain, cramping, bloating, and constipation. Thyroid disorders, such as hypothyroidism, can also cause constipation, as can colon cancer, which is typically diagnosed when a person experiences weight loss, blood in the stool, or changes in bowel habits. Constipation can also be a symptom of a fever, which can be caused by viral or bacterial infections. In any case, anyone experiencing any of these conditions should seek medical attention. Symptoms of constipation. Fewer bowel movements than usual. If you are experiencing fewer bowel movements than usual in constipation, as well as a fever, it is important to seek medical attention. These can be signs of an underlying health issue and should not be ignored. Constipation can be caused by a variety of things, from a lack of fiber in your diet to dehydration and even certain medical conditions. A fever may indicate an infection or another serious medical issue. It is important to talk to your doctor to get a proper diagnosis and treatment. Straining during bowel movements. The symptoms of straining during bowel movements, constipation, and fever can indicate a variety of conditions. Straining during bowel movements can indicate constipation, which can be caused by a number of factors, including lack of fiber and water intake, certain medications, and certain medical conditions. Constipation can also be accompanied by a fever, which may indicate an infection of the digestive system, such as an intestinal infection. If you are experiencing any of these symptoms, it is important to speak to your doctor as soon as possible so that a proper diagnosis can be made and appropriate treatment can be provided. Hard or lumpy stools. Suffering from hard or lumpy stools and constipation can be an uncomfortable and even painful experience, and if accompanied by a fever, could be a sign of an underlying medical condition. It is important to seek medical advice if this symptom combination persists, as it could indicate a more serious health issue. Talk to your doctor to determine the cause of your hard or lumpy stools and constipation, as well as the accompanying fever, and to receive the appropriate medical treatment. Bloating. If you are experiencing bloating, constipation, and fever, it is important to seek medical attention as soon as possible. These symptoms can be indicative of a variety of health problems, from a simple stomach virus to an underlying medical condition. Bloating can be caused by overeating, consuming too much salt, or eating foods that are difficult to digest. Constipation can be caused by a lack of fiber in your diet, dehydration, or certain medications. Fever often signals the presence of an infection and should always be taken seriously. If you are experiencing any of these symptoms, please consult your doctor right away. Abdominal pain. Someone experiencing abdominal pain, constipation, and fever should seek medical attention. These symptoms can be indicators of a wide range of illnesses, and it is important to get a diagnosis in order to determine the best course of treatment. Abdominal pain can be a sign of many things, including appendicitis, Crohn's disease, and even kidney stones. Constipation can be a sign of an underlying health condition such as irritable bowel syndrome, or it can be a side effect of certain medications. Fever can be a sign of infection, such as influenza, or it can be a side effect of certain medical conditions. It is important to get medical advice to correctly diagnose and treat the underlying cause of these symptoms. Causes of fever. 1. Infection, such as a cold, flu, or urinary tract infection. 2. Inflammatory conditions, such as arthritis or inflammatory bowel disease. 3. Certain medications. 4. Heat exhaustion or heat stroke. Symptoms of fever. 1. Elevated body temperature, above 100.4 degrees Fahrenheit or 38 degrees Celsius. 2. Sweating. 3. Chills. 4. Headache. 5. Muscle aches. Treatment of constipation. 1. Increase fiber intake through foods such as fruits, vegetables, and whole grains. 2. Drink plenty of water to help soften stools. 3. Exercise regularly to help promote bowel movements. 4. Use laxatives or stool softeners as directed by a healthcare provider. Treatment of fever. 1. Rest and drink plenty of fluids to stay hydrated. 2. Over-the-counter fever reducers such as acetaminophen or ibuprofen can help reduce fever and relieve discomfort. 3. Treat underlying medical conditions or infections as directed by a healthcare provider. If you experience constipation and fever together, it's important to speak with a healthcare provider to determine the underlying cause and appropriate treatment. In conclusion, constipation fever is a condition that can be treated with dietary and lifestyle changes. It is important to make sure your diet is high in fiber and to stay hydrated. Exercise is also beneficial for relieving constipation. Other treatments may include laxatives, enemas, or medications. It is important to talk to your doctor if you are experiencing constipation fever so that you can find the best treatment for you. Thanks for watching.